Okay, this is the laparoscopic CUSA. We're going to put it together. 23 kilohertz is what you're opening, not 36. 23 kilohertz. We're going to open up a 23 kilohertz wrench, green. We're opening up a 23 kilohertz tubing, a lot bigger than neuro. Okay. Now this is what's in the box. Everything comes together. I've got my handle. I've got my, I believe this is a stabilizer. I've got my long tip. I've got my flute. I've got my cap, my 2 O-rings, and also my steel stylet, I believe, to clear out the tubing. So I'm gonna start, okay? The first thing you're gonna do is you're gonna grab your handle and you're just gonna start twisting. You're gonna twist, 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 twist your long, long piece on there. It's got a long tip. The tips are not disposable. This will go into my stabilizer. I'm gonna use my wrench, green. I know your holder's not really that green, but green to green. And it's gonna be a 2-click action, okay? So right inside the piece here. So you gotta push it in. 1, 2, and that's all. If you do it too tightly, it will be over torqued. Next, I'm gonna put my O-rings on. I've got a black one. The black one is gonna end up coming right over here. I'm gonna bring it up the shaft. It's going onto my light green handle, okay? Fits right in here. The next is my green O-ring. I'm gonna bring that over, and it's gonna go right before your opening, okay? That's where that green one sits, right in here. That's where it sits, before the opening. Now I'm gonna align my cap. This is the cap. You're gonna align your dots, dot cap, and I'm gonna put, once I have it inside, I'm going to turn it to face this cap. This dot right here. 1 and 2 will be aligned completely. Do not over twist. Then it's gonna be my flute. This is called a flute. You're gonna have the tip of the water face the tip of the top. If everything aligns correctly, it looks great, works great. This is gonna be like this. Now I'm gonna grab my tubing that I've also this will be done sterilely, and this tubing will follow right in here. It kind of looks like a duck. It will go right inside the hole here. You're gonna snap it in. It snaps on both sides. You can hear a snap. You're gonna click it onto your piece here so it stabilizes. At this point, you're gonna actually take your guide wire. This is a wire. You're gonna put it through to make sure that you are aligned. And how you will find out is you're gonna see it come up to where the duck is. So I'm gonna move it so you can see it. That's where you're gonna see it to make sure that the dots have aligned. You have an opening. Your handpiece will be nice and cool. This will now get for your irrigation. It will twist onto your irrigation here. You're gonna clip it onto your power cord, and you're gonna go all the way until you throw it off to your nurses. What happens at this point, guys? You have to follow the direction on the machine to follow. It's the same thing. I have all the settings written in all the books of the doctors. Good luck. This tip is not disposable. Do not throw off your wrench until the end of the case. You need it to take it off. Good luck.